Cellulite and skin laxity of the thighs and buttocks are among the most common concerns that I encounter in my plastic surgery practice. I'm Dr. David Stoker, and I am so excited to tell you about the revolutionary procedure that I had developed to treat these problems in a way that was never before possible. I call it the Bikini Body Lift. The Bikini Body Lift is the most effective way to treat cellulite and skin laxity of the thighs and buttocks. In this video, I'm going to show you how. We'll talk about the thigh and buttocks conditions that I can treat, the advanced surgical techniques that I developed, the reasons for our unmatched surgical results. Let's look at over 20 beautiful examples of my Bikini Body Lift. This first case is really dramatic. A 58-year-old mother of two from Arizona lost 60 pounds, but she's got severe laxity and motion deformity when she flexes her glutes. When she shakes her thighs or walks, she's mortified about her appearance. This is one of the most spectacular transformations imaginable, and I did it with our Bikini Body Lift. Imagine if you were that person. I love this next case. She's a beautiful 48-year-old mother of two who lost almost 100 pounds following her second pregnancy. She has severe cellulite and skin laxity of her buttocks, yet she has great muscles underneath from working out and even competing for fitness. The Bikini Body Lift transformed her figure, eliminated all cellulite and all skin laxity of her buttocks and thighs, 360 degrees around. I am thrilled with her appearance here, and I know that she is too. This is a 59-year-old physician from Florida who just 18 months earlier underwent a circumferential body lift by a board-certified plastic surgeon with an excellent reputation. Unfortunately, it's a difficult operation and they were unable to achieve anywhere near the result she was hoping for. So she decided to fly out to Los Angeles to undergo our Bikini Body Lift. We were able to eliminate all cellulite and skin laxity of her buttocks and thighs all the way down to the knees. I was also able to reposition her scar into a lower, more discreet location where she can wear a small bikini, totally conceal her incisions. I know that she is thrilled with her new appearance, and she can't wait to put on her first bikini back in her home state of Florida. This is a beautiful transformation on a woman who underwent previous tummy tuck and lipo, which caused deformity on her thighs. She flew in from Arizona. Look at that beautiful athletic buttocks after the Bikini Body Lift. This is a beautiful 44-year-old mother of four who underwent a Bikini Body Lift to eliminate the amount of cellulite and skin laxity she had on her buttocks and lateral thighs, and also improve the appearance of her abdomen where she had already had a previous tummy tuck. As you can see, when she flexes or rotates or moves, she's got an almost perfect figure now, especially considering she's had 4 babies and is in her mid-40s. I'm thrilled for this patient with her Bikini Body Lift. This is a 55-year-old mother of two who lost about 60 pounds but had severe laxity of her thighs and buttocks. She already had a body lift by another surgeon in the West, and look at the result. The scar is very high on one side and much lower on the other. She also had an inner thigh lift with inferior gluteal scars here, but the result is non-existent. On the profile view, you see her buttocks is lifted. It's curvy now, not flat. On the frontal view, even though she's had a previous tummy tuck and inner thigh lift, you see the result was not very good. I completely resolved that. She's only 1 week post-op, but the incision is hidden down low. Her mons pubis area and genitalia are no longer deformed. Her abdomen is flat. The skin on her thighs is tightened all the way down to her knees. When this patient flew in for surgery, she never imagined she could have such a gorgeous result. This patient lost 160 pounds. She's shown 5 days post-op because she flew in for surgery. An incredible transformation. The whole back, the buttocks is curvy, the thigh laxity is almost completely resolved. She's looking beautiful. This patient had previous liposuction that caused severe wrinkling of her buttocks. On the oblique view, she's as flat as can be on her backside. I restored those curves almost as though her bottom had fallen down around her mid-thighs, and I pulled it up to recreate those curves, 100% resolution of the wrinkles on her bottom. Look at the animation deformity she has when she flexes her bottom, completely gone after surgery. This is one of my favorite bottoms that I've created. A patient from Boston. Look at how flat and loose her buttocks and thighs are. When I'm demonstrating what kind of lift I can get, I actually exceeded that with the result that you see on the right. This young patient wanted less jiggling when she walks, so I shot a video of her that demonstrates very clearly the improvement that we got on her with the Bikini Body Lift. Look at this beautiful result. This patient went through menopause and developed cellulite and skin laxity of her buttocks. I also revised her tummy tucks with our Bikini body lift. I love this case, a beautiful 41-year-old mom. She has a scar on her right flank from previous surgery. Her fat distribution wasn't optimal. I performed a Bikini body lift and selective liposuction that transformed her figure. Look at this body in a bikini. She is the definition of a beautiful bikini body lift. This is a gorgeous 41-year-old mom who unbelievably lost over 100 pounds. Look at how beautiful she is afterwards. We have a complete resolution of cellulite here, the skin laxity. Look at the bottom of her buttocks and thighs. The bikini body lift is circumferential. Look at how gorgeous her abdomen is afterwards. Just 7 weeks post-op, already looking amazing. I want you to see in this video the animation of how I'm able to correct the laxity and cellulite of her lateral thighs. This patient flew in from London for the treatment of lipedema. Liposuction had been ineffective for her. The bikini body lift transformed her figure and solved that problem entirely. This beautiful mom flew in from the southeastern United States with her husband, who's a surgeon himself. The bikini body lift transformed her body and got rid of that cellulite and skin laxity that embarrassed her when she wore her bikini. This is a 43-year-old scientist who flew in from North Carolina following over a 100-pound weight loss. She wanted to eliminate the cellulite and skin laxity and jiggling of her buttocks and thighs, as well as narrow her waist. We performed a bikini body lift and were able to transform her into feeling comfortable in a bikini again. I'm so thrilled with this outcome, and I know she is too. This 52-year-old mom used to be a model. She had 3 babies, went through menopause, developed cellulite and skin laxity of her buttocks that she found embarrassing. The bikini body lift transformed her and made her feel comfortable again in that bikini. This beautiful 54-year-old Latina mom lost a bit of weight and developed cellulite and skin laxity of her lower buttocks and thighs. On the oblique view in particular, you can see how this must have really bothered her. On the lateral view, you see the power of my bikini body lift to restore youthful curves, to enhance projection of the buttocks, and to smooth the skin and cellulite of the buttocks and thighs. This beautiful 59-year-old mom developed severe wrinkling and cellulite of her buttocks following menopause. She flew out from Indiana, and our bikini body lift transformed her figure and made her comfortable again in her bikini. I love this profile view. Look at how much we lifted the buttocks up. She's got beautiful curves. Some people worry if I'm gonna flatten the buttocks, but here you see we do the opposite. We enhance the curves and rid the patient of the cellulite and skin laxity. This is a 45-year-old mom who lost 90 pounds and had a circumferential body lift done out of state by another surgeon. The scars are super high here. She's totally unable to conceal them under a bathing suit. And you can see that the cellulite of the buttocks still remains. After the bikini body lift performed here in Marina del Rey, we have complete resolution of her problem. On the frontal view, you can see her irregular abdominoplasty scar from the previous surgeons. We corrected all of that and I hid it underneath a tiny little bikini. The 61-year-old woman had severe dimpling, cellulite, and skin laxity of her buttocks. Our bikini body lift completely resolved those issues. Look at these views, both posterior and oblique. In this animation video, you can see a really beautiful enhancement of her figure. Obviously, this is a very happy patient. This patient is a 58-year-old mother of 2 who had a previous liposuction of her buttocks and lost approximately 60 pounds following her second baby. She has a lot of cellulite and dimpling, and you can see the streaks and depressions she has on her lateral buttocks. She was a beautiful candidate for a bikini body lift, and you can see how her bottom and thighs were transformed 360 degrees. The jiggling, the shaking, the cellulite are all resolved. This 63-year-old patient lost almost 100 pounds. She was bothered by the cellulite on her buttocks. The bikini body lift resolved that issue for her. On the side view, check out how curvy her bottom is after surgery. I love it. Before it was totally flat, and I pulled up that tissue and restructured it almost like I was pulling her pants up from down around her mid-thighs to give her a curvy bottom. This 43-year-old mom lost a lot of weight. Her buttocks was very wrinkly and had a lot of cellulite. Afterwards, when we performed the bikini body lift, we were able to restore her figure to a beautiful, youthful form that makes her very happy. This is a 56-year-old mother of two and retired nurse who lost approximately 90 pounds. We transformed her with a circumferential body lift, which eliminated the cellulite and skin laxity of her buttocks and even improved her thighs as well. This patient's only 37 years old, didn't lose any weight, but just has a genetic trait in her family of loose skin and wrinkles on the bottom, and she was not happy about it. I performed the bikini body lift, and shortly after surgery, look at this gorgeous transformation. She is so much happier now. I love this case because it shows the power of my bikini body lift in ridding the bottom of cellulite. Imagine how happy this patient is to put on a bathing suit after this operation. This is a 51-year-old mother of four. She takes great care of herself, is super fit, but her hormones changed the last few years with menopause, and she was distraught over the cellulite in her buttocks. She wants to hang out in a bikini at the pool with her kids. Look at her just 1 week afterwards. She looks amazing. We made her more hourglass by sculpting her figure with 360 lipo, and the Brazilian body lift transformed her bottom and thighs. Just 1 week after, she's looking amazing in a bikini. On this oblique view, you can see the dramatic improvement in cellulite, the curvature of her buttocks, and notice that we increased the prominence and the curves of the buttocks to make her more feminine. She doesn't have a flat bottom. She has a curvy, beautiful bottom. This is an interesting case on a 56-year-old woman who's had 2 babies and lost over 100 pounds. Unfortunately, even though she already had a lower body lift by a surgeon in her home state of Wisconsin, they were not able to accomplish the result that she desired. She still has extreme cellulite and skin laxity of her buttocks and thighs. With my bikini body lift, I was able to completely eliminate that cellulite and skin laxity of her buttocks and thighs all the way down to her lower thighs. She's thrilled with this outcome. She's also pleased that I was able to lower her incision so it's easily concealed underneath her bikini. I know she is thrilled with this outcome, and it's a great demonstration of the difference between my bikini body lift operation and a body lift performed by other board-certified plastic surgeons. This 56-year-old mom lost about 90 pounds, and she flew in from Nevada to be transformed with our bikini body lift. Look at this gorgeous outcome just 9 days post-op. You see in these animation videos how dramatic it is. It's not just the static wrinkles and cellulite, but this bouncing and jiggling she was very unhappy with. I know she is so pleased to look great in a bathing suit now. This is a wonderful example of the power of our bikini body lift. This 44-year-old woman fortunately lost over 250 pounds. This is the biggest one I've ever performed with a double body lift in 2 stages. Our bikini body lift down below. Look at the improvement all the way down to her knees. I performed a upper body lift circumferentially, including arm lift and breast lift. I am so happy for this beautiful patient. For so many patients, it's not about being overweight. It's about their cellulite, the skin laxity, the flattening of their buttocks, and the jiggling when they walk. These are the problems that I can treat very well with the bikini body lift. The bikini body lift isn't something that I developed overnight. 25 years ago, I learned from the best during my residency training. And then in my practice, I became an expert at helping people following massive weight loss. I did TV shows such as NBC's Biggest Loser and ABC's Extreme Makeover Weight Loss Edition. And through that, I ended up doing thousands of different types of lifts in patients who had lost massive amounts of weight. These are very difficult procedures technically, but I got good at it. And the better I got, the more patients who wanted me to perform the same operations on them, even though they hadn't lost massive amounts of weight. At this point now with the bikini body lift, patients seek my help when they've lost only a small amount of weight, when they've had several children, when they've gone through menopause. All of those are common reasons why they would be bothered by cellulite and skin laxity of their buttocks and thighs. And these are now candidates for the bikini body lift surgery to solve their problem. My revolutionary bikini body lift incorporates the following principles to obtain the best looking scars. First, I want to hide those incisions in a convenient location. That's where the bikini will lie. So I mark that out before we start the surgery. It sounds simple, but it's not, because we have tissue moving so much in different vectors in different parts of the body. It's an important challenge, and it starts with the markings. The second important principle is to use meticulous technique in the closure. This involves hundreds of internal sutures that are able to lift and take tension off of the wound and distribute it along the entire surface area of the surgical incisions in a way that will minimize the tension on the skin and obtain the best scars possible. And lastly, we are very diligent about post-operative care. Even when the patient is healed a couple of months following surgery, we are not saying goodbye to that patient. We want them to come back, and we want to work on those scars until they are as thin and flat and nice as possible. So what do the scars actually look like? Of course, everyone wants to know, and here are many examples. When you use the best techniques, we tend to get very beautiful scars. It's important to note, however, there is a lot of genetic variability, and it's not always the case. Tummy tuck scar. This is an ultra close-up view over 1 year following a body lift operation. Here you can see the hair follicles in such a close-up. Obviously, there's nothing to be embarrassed about. You can see here that the underwear elastic markings are actually more significant than the scars in some locations. That's an ideal situation to be in. I'm adjusting the position of the red underwear in this patient to show you a beautifully healing wound. This is less than 3 weeks following surgery. I just removed the Steri-Strip tape from the wound. It's barely a scar, but look how beautiful it is already and how nicely positioned it is. This patient is approximately 3 months following surgery, and she just underwent fractional carbon dioxide laser treatment of her scar. That's why it's a little bit red and a little bit wider than these other incisions. That incision also is going to fade beautifully over the next 6 months. Positioning the scar underneath where the desired bathing suit or underwear position is totally key. And it's difficult to achieve. But after doing so many hundreds of these procedures, I feel like we've got it down. This case in a darker skinned patient illustrates how beautiful a scar can appear even in a patient with additional pigment. The bikini body lift is a revolutionary procedure. It has transformed our ability to improve the appearance of the buttocks and thighs. For more information, you've got to check out our website, drstoker.com. We've got over 12,000 beautiful before and after pictures and videos to match.